Hi everyone, my name is Krista Barbieri and I'm here to do a presentation on eating disorders. Now this presentation is intended for teachers, school counselors, the nurse, administration, anyone who really works with students would benefit from this presentation. So first I want to talk to you guys about the definition of what an eating disorder actually is. It is any of a range of psychological disorders characterized by abnormal or disturbed eating habits. Now, so you might ask yourself, what does this topic have anything to do with our high school students, or any student in particular? Well, I found some statistics that are from Marosol and the North Dakota State University, and it says 8 million Americans, 7 million women, and 1 million men have an eating disorder. About 10 to 15% of all Americans suffer from some type of serious eating disorder. 1 of every 200 American women suffer from anorexia. 90% of those who have an eating disorder are women between the ages of 12 and 25. It is estimated that currently 11% of high school students have been diagnosed with an eating disorder, and 51% of 9 to 10-year-olds girls feel better about themselves if they are on a diet. 42% of first to third grade girls want to be thinner. Now, the last two statistics really show that even in first grade or 9-10-year-old girls have these thoughts about wanting to be thinner or feeling better about themselves being on a diet. This really shows that these are students that could be at risk and they could later on develop an eating disorder. So it's very, very important to know the mindset going into high school. So we're going to talk about types of eating disorders. The first one is anorexia nervosa, which is inadequate food intake leading to weight that is clearly low. It's constant, intense fear of weight gain. It's an inability to appreciate the severity in the situation. Now under this, there's two types. The first one is binge eating or purging type, which involves the individual that does have anorexia is doing binge eating and purging. And the next type is restricted type, which means they're not binge eating or purging. The next type of eating disorder is binge eating disorder. Binge eating disorder is frequent episodes of consuming very large amounts of food, but without behaviors to prevent weight gain, such as self-induced vomiting. This individual might have feelings of shame or guilt. Now, some indications that the binge eating is out of control is they're eating when they're not hungry, they're eating until the point they don't feel comfortable, they're just eating because they're lonely. Those are indications that it is out of control. Now the next one is bulimia nervosa, which is frequent episodes of consuming very large amount of food, but it's followed by behaviors to prevent weight gain, such as self-induced vomiting. So that's the difference between binge eating disorder and bulimia. They're both the individual takes in a lot of food, but for bulimia, they do behaviors that they won't gain the weight from eating the food, when binge eating does not. Now, for all those three types, the individual self-esteem is overrelated to the body image. Now, the next section is other specific feeding or eating disorders. So, the first type under that is atypical anorexia nervosa, which is exactly the same as anorexia nervosa, but the weight is not below normal. The next is bulimia nervosa, same thing as the one I just discussed, but has less frequent behaviors. Same with binge eating disorder, same thing I discussed previously, but with less frequent occurrences. That is a purging disorder, so that's when an individual just engages in purging and not binge eating. And lastly, there is night eating syndrome, which is excessive nighttime eating. So the last section is additional eating and feeding disorders. The first one is avoidance and restrictive food taking disorder. The next is pica. Now, pica is an eating disorder that involves eating items that are not typically thought of as food and do not contain significant nutritional value. Now, in my research, I found that this is not very common in America, but it could be common, and it is common in other cultures. So it's very, very important to keep this in mind when we have students that do come from different cultures or do come from different countries, that this could very possibly be a possibility for them. So it's good to still be aware of it. Now the next one is rumination disorder. Now this is common within children, youth usually, or even infants. It's when a child springs up swallow food and then re-chews it, either spits it out or can swallow it again. And the last is unspecific feeding or eating disorder. Now for application for school counselors, and this can go along with teachers, administration, it's very, very important to first identify the symptoms and the at-risk students, which I will discuss in the next slide, what those symptoms are. Next is the elimination of PE classes doing public weigh-ins and BMI measurements. I know it's very important for the gym classes and the PE and health classes to take the students' weight, but instead of doing it and calling up in front of everyone and doing their weight in front of everyone, maybe having them bring them into an office, so then one by one they go in and they have just a one-on-one time discussing their weight, discussing their BMI measurements. This can help decrease the peer pressure or the embarrassment that the individual may feel. Next is to advocate for a wide range of nutrition foods in vending machines and cafeterias. What this means is looking at your vending machines in your schools, noticing that there's soda, candy, snacks, and all of them, maybe replacing them with water bottles, maybe like apples, bananas, more healthier options. Also in the cafeteria, I know it's very common that pizza is an everyday thing that is available. Maybe having a salad that's always available or sandwiches are always available. Just having more options that in like the healthier route is always better. Also, to always follow ethical guidelines. Then we're later going to discuss treatment options and resources. So for signs and symptoms, I broke it up into three sections: emotional, physical, and behavior. So first we're going to talk about the emotional. Usually the individual has changes in attitude and performance. Maybe dropping in academics would be one thing that's very important to be observant on. Expresses body image concerns and unable to accept compliments. Emotions are usually absent. What is very, very important is a victim of body or weight bullying currently or in the past. Now, this is something that can identify an at-risk student for an eating disorder if they were a victim of this type of bullying. Even though it's not currently happening, or even if it happened years ago, they're still at risk for developing an eating disorder. So it's very, very important to keep these students in mind. Also, as the student is obsessed with maintaining an unhealthy eating habit in order to achieve in a sport, club, dancing, or acting. Now, I know a very common sport that is known for this is wrestling. So using that as an example, students may have to reach a certain weight in order to be in a certain weight class, and they won't have a desire to be in a certain weight class. So if they are over the weight or even under the weight, they might develop an healthy eating habit in order to achieve that weight. Next is physical, which is sudden weight loss or gain in a short amount of time. Dry hair, skin, or signs of dehydration, dizziness, dark circle in the eyes, bloodshot eyes, very tired, abdominal pain is very common. Now for behavior, diets or pretends to eat food and throws it away. So this is very, very important to monitor for those who do lunch duty. Just observe it, walk around, look at your students, see if a student is eating. Now it's also very important to keep an eye out, because even though a student goes up and gets lunch every day, it doesn't necessarily mean they're eating. It can mean that they're bringing the lunch back or bringing it and throwing it right out, or bring it back to the table and handing all their food out to their friends, being, oh, who wants this, who wants that, and not actually eating anything. Also, constantly talks about food or makes lists of calories eaten. Now, nowadays with the technology, I know there's apps that can keep track of calories. So it's very important that maybe the student is not writing down everything in a notebook, but could be keeping track of it in their phone. Makes frequent trips to the bathroom, has difficulty sitting still, maybe very jumpy, shows some type of compulsive behavior, and also may wear baggy clothing to hide the weight gain or the weight loss. Now, some individuals could be completely aware that they are losing weight really fast, and instead of drawing attention to them, they might wear baggy clothing in order to hide this, to show that, hey, I'm not losing weight, use it as a way to hide. So some treatment options, individual group counseling, very, very important. Creating a safe place for these individuals. It's very, very hard for them. It's a lot of self-esteem problems they're having. So it's very important to keep a safe, non-judgmental area for them. Also, medication, medical care, and monitoring kind of go hand in hand. If a student gets to that point where it's out of our hands and they do need medical help, it's very important that they receive the medical help that they need. Nutrition counseling could be awesome too, helping working with a student on maybe developing better eating habits, or changing their diet, whatever it may be, but getting the right nutrition in and making sure they're getting the right stuff that they need, like vitamins, is very, very important. For the last is cognitive behavior therapy. Now, cognitive behavior therapy is important because a lot of these behaviors, these individuals may not be able to control. So in order to decrease this behavior, the cognitive behavior therapy could be very helpful for that. Now, some resources I found that are in the New Jersey area is the Ref and Fru Center, the Gen Psych, Center for Discovery, Ocean Insight Center, Center for Eating Disorders Care, Goreb Children's Center Eating Disorder Program, Cornerstone Day School, and support groups. In my office, I do have a bunch of lists for these support groups that are in the area. I do have a list, so if you do need a resource, you can always come to me and I can provide them to you. All these centers, programs, and groups do care for individuals with eating disorders. The children one and the Corner Day School is for students, but everything else they could do any age. And this is my reference page. These are the sources I found all information in. And I really do appreciate you guys watching this and taking the time out of your day to listen to about eating disorders. And I really hope you learned something today. Thank you.